were talking about how everybody really can play a role in the behavioral health of the population. How do employers, through things like EAPs or, perhaps integrations with things like Mindoula play, or even in schools with the counselors, what role and how important are they in this collaborative care network?
Critical, right? I think the more touch points we have to demystify the access, the better, right? If you're hearing about it from an employer as an EAP benefit, because it doesn't cost anything typically, right? The screening tool is free, right? It's a free licensed opportunity, right? Working with national payers to get out in front of people, EAPs to get in front of people, I think is a great step. I think you touch on a great opportunity with our school districts, right? My kids are online, oh my God, way more than they should be, right? I'm frightened every day I go look and review their screen time with them about what they've been doing on their devices, right? What if every day part of the school curriculum was we have them take a mental health assessment as part of homeroom, and we're evaluating that on a weekly basis, and we're evaluating the entire population of a town on their behavioral health needs in a very, very low stress and low threat environment. And we're checking that off. We're checking that box every week.
If you did that, I feel like, especially in school, and if it was on a daily or weekly basis, like you said, I feel like you'd really probably be able to get to the root of so many other things. I mean, from like child abuse to other situations, hunger at home, because you'd see that on, if they're reporting accurately.
Mm-hmm. And I think
the stress that they're suffering.
About these tools that you're taking online, you're taking them from the privacy of your own home, and the data shows that the responses you get are far more true to form than not, because of the location you're able to take them. I think there's a huge opportunity. I would love to embrace with school districts all over the country to think about how we could do this at scale.
Are you seeing any success there, James? Are you seeing any school districts that have been able to do it well?
At Mindoula, there are several school districts that we are working with or be in discussions with to deploy this kind of a resource. We have a suicide prevention program, which is geared toward teens and adolescents, which is showing great promise. I think the whole opportunity with the children, quite frankly, is to demystify it, as we've begun to do, and make it easy for them to access and give them a safe space to have a conversation. I look around, our friends in our town, and I've seen a very definite pivot in the engagement, if you will, of the youth in the town, just because of COVID and the isolation that they've all been struggling with. It's no fault of their own. We are by design social animals, if you will. And when we can't do that, this is great. FaceTime has saved a lot of relationships with parents and siblings and grandparents, but it only gets us about this far.
So what are the solutions then, James? The typical things you've actually described quite a few solutions already, but at the system level, at the policy level, at the school level. But if you could speak to our average viewer who's sitting at home thinking, okay, maybe I have a behavioral health issue, maybe I don't know. Do you have any tips?
The answers are not simple, but they are, right? And the simple answer is you've got to be your own advocate. You've got to be your own voice in the healthcare continuum. It's that way on the medical side of the house. It's the same on the psychiatric side of the house, the behavioral side of the house. Everybody has challenges at one point or another in their lives, and you may not recognize you have the challenge. Others in your care continuum, or your orbit, if you will, or your pod, as we call them today, may recognize that you're struggling. I would say if you get feedback, take it at face value.
Mm-hmm.
You've done the test, right, Stephanie? You've done the test. You understand the ease of that test. I would urge everybody to go up and seek out. It doesn't have to be the Mindoula tool. It can be a tool that's out there. Take the test, see what it tells you. And if it tells you something you weren't anticipating, that's okay. It really is okay. Mm-hmm. We all have bad days. But then you've got to reach out to your doc. If you are lucky to have a therapist or a psychiatrist that you've been working with, and there's a change, pick up the phone and have a conversation. If you're one of the 78% of Americans who don't, that's okay too, because pick up the phone, call your PCP and say, hey, you know what? I took this test. I've got some struggles. Can you help me through it? And he or she will have a conversation with you. They will. Their level of comfort in terms of treating that may differ. The great news is that companies like Mindoula are springing up all over the country with better success, some with better success than others, right? To create this bandwidth and this groundswell of coverage. You have to stand up for yourself and say, I need this help. Help me find out where I can get it.
Where do
Wonderful
people get the
advice.
strength to do that? How can you encourage them if they're so deep into this, or they're living by themselves during COVID and really have just like sunken into that mind space? What can you tell those types of people? What's their first step to try to move into a better spot?
You got to lean on your network, right? Everybody's got, and I'm approaching, that midpoint of my life. I turned 50 a couple of years ago, and I had this revelation that when you hit 50, there's really 5 people that are your core, and they've come from, your latter years of high school and your first couple of years of college. And that's what I found. And many of my friends have had the same conversation. It's about 5 people that are your inner circle. My recommendation is tap that inner circle. I was very fortunate to spend time with one of my friends around the holidays. And we had a very frank and open conversation, and he was very, very responsive and appreciative of that discussion. And, you got to lean in, and you got to make it personal, and you got to ask for help. You just got to open your mouth. And that is a very big first step, but it has to be the first step.
What wonderful advice. That's great.
What if you say to people who think, okay, mental health is so important right now, and it's because of COVID, but once COVID goes away and everybody has the vaccine, then it's going to be okay, and we're all going to go back to whatever it was. What do you say to those people, and why this remains an important thing that should have a lot of funding and focus?
Well, I think if we go back to, prior pandemics, like the Spanish flu and others, and this goes back a very long time, the needs of the population from a behavioral health perspective cascaded 4 to 5 years beyond the end of the pandemic. And I use air quotes a lot here in my office, especially when I'm talking to myself, right? The issue is not going away. Just because COVID is gone doesn't mean magically your gig workers have a job back, right? Doesn't mean that magically full employment happens overnight. The numbers we talked about earlier, it's a 4-year runway to full employment, right? That means it's 4 years of food insecurity, 4 years of added stress around income and paying my bills. It's 4 years of increased anxiety and increased depression, and an opportunity to make some poor choices, right? And those poor choices don't have to be catastrophic or epic. It can be small bad choices that accumulate over time that take you to a very dark place, right? So you really need to pay attention to the next step, and it's an evolutionary step in the solving of COVID. It's the behavioral health needs of the population, right? We've seen this happen in war zones, where we go in and defeat the bad guy and then leave, and don't spend the time and the energy to rebuild the country and re-educate the populations and rebuild that infrastructure. Allows bad things to take hold and bad things to come out of those same environments. We can't do the same thing here.
Well, and James, as you were saying earlier, it's even prior to COVID. It's hard to recall that now, maybe 10 months into the crisis. And we think obviously a lot of this is becoming amplified because of COVID. But everything we're talking about has been present and growing as a national urgency and emergency for decades, right? So that's not getting put back in the bottle. I mean, that's a significant public health issue that has to be addressed, COVID or no COVID.
Well, yeah, if you think back pre-COVID, and we go back 20, 30 years at this point, maybe a little bit longer, they closed the state psychiatric hospitals, right? They pushed all of those chronically mentally ill patients out into the community. And I'm not suggesting that the state hospitals in all instances were well run, or they were a great place to be. I'm saying it gave the chronically mentally ill who really needed institutionalization a safe place to call home, right? And what we did by closing those, and I'm sure they had good reasons at the time, it predates most of us on the phone call, it pushed those folks into the community, which at the time thought it was a better place for them to try to get some semblance of what we would call normalcy. But that pushed that need into the ED, right? So now your EDs are overloaded. There's no bed space from an acute care perspective. Anybody who is now, as we call it, the walking wounded, the walking well, who have these under managed behavioral health needs like depression and anxiety, when they reach an acute critical phase of their life, they struggle to find a bed. They struggle to find a bed because we have not made it a priority to get more behavioral health beds into our community hospitals, into our academic medical centers, because it's usually, unfortunately, a financial loss leader, right? There's not a lot of money in treating behavioral health needs. There's a lot of money to be saved, right? And there's a lot of money opportunity on the table from a savings perspective. but you don't see them building new wings to treat behavioral health like they do heart centers, right? Or diabetes treatment centers. So I think we have to prioritize the needs of the population, the health and wellness of the population, the behavioral health needs of the population. At the same level, we're funding things like heart failure, cancer centers, and others.
How do you switch that and make people understand the true value of focusing on this? Because, like you said, it's not something that you think of immediately, but if you put these people out on the street decades ago and they don't have anywhere safe to go now, then it seems like if you focus on behavioral health and start to catch these problems or get people into the right situations that they need to be, if they do need those resources, you could even start to solve or improve things like homelessness, drug use, all these other things
Right.
that would save tons of money system wide across the spectrum.
Absolutely. And I'll reference, in my work on the medical side of the equation with large health systems and integrated delivery groups and primary care doctors, we're focused on the chronic conditions, diabetes, heart failure, hypertension. We focus our energies on those patients who are spending the most because we could save money and meet our clinical targets. The challenge was we didn't spend any money to get ahead of the bus, as I like to say. Right? Those patients who were pre-disease or early in their disease state who didn't yet have that spend were often left off the equation. The nice thing about this collaborative care approach and this community-focused behavioral health assessment, if you will, allows us to broadly attach the population and address the population's needs and get it into the engagement level prior to them having acute level of events.
Mm-hmm.
Right? So if we can stop them having an acute episode, not only do we improve their quality of life, right, and improve their outlook and their wellness factor, but we also save those resources for the patients who really have those acute needs, who can't wait 14 weeks for it to be seen, who can't wait 10 days, 15 days for an acute care bed, right? It really allows us to right size the population and point the right tools to the right patients at the right time.
Mm-hmm. So somehow the system has to get ahead of the curve, is how you're describing it very vividly. And the individuals have a big role to play in that. We as consumers can help getting ahead of the curve by doing some of the things you're talking about. Take a self-assessment, reach out to our networks, make sure we're doing whatever we can to have our own wellness routines.
Yeah, I mean, think about this. This is a pretty scary significant. I think it's every 13 minutes, somebody in the United States dies of suicide. Think about that for a second. Like that's
it's been how many people in the time that we've been talking?
Yeah.
Wow. Yeah.
Like there's been a 60% increase in the psychiatric needs of patients hitting the ED. 13% of people in the United States receive minimally appropriate care for a behavioral health diagnosis. Right. So these numbers are real, right? If you ask primary care doctors, the data shows that about less than 20% of those primary care docs feel very good or very prepared about being able to diagnose a behavioral health need, right? So there's a lot of opportunity here for us to rethink this continuum, ask good questions, be around advocate, take these self-assessment tools. They're real, use them.
We've talked a lot about our network, our providers, but we haven't said anything about what do parents do? How do parents cope? You're a dad. How do you handle this with your own children, knowing everything that you do and having that benefit? How do you help them through all these difficult times? And what would you tell other parents? I'm a parent of a 5-year-old. Apurv has teenagers. Mm-hmm. What do we do?
I think it's been fantastic, to be honest with you, being stuck at home for the last year and being forced to be present with everybody. I used to travel a lot for work. I was gone 3 or 4 days a week. I can't wait to travel again. Right? I'm a social beast like everybody else, but helping my kids understand that we're all human, right? I have good days and bad days. If I'm in my office with the door closed by 8 o'clock in the morning, they know something's going on, right? So helping them understand that everybody's human, it's okay to have a bad day, and it's more importantly, it's okay to ask for help, right? I used to do 2-minute check-ins with the kids every night before they went to bed, just reflecting on their day. Nobody wants to do that anymore. But you try to do that in the car with them, right? How you doing? Like what, how was school today? Like what did you do? How are you feeling? And then allowing them a safe space, it's really the car for us, I think, at this point.
Would you tell other parents who might think that those 2 minutes might seem insignificant, that those 2 minutes actually are really important, and how that opens things up?
It was the most impactful moment of my day. So when I was traveling a lot, I made sure those 2 minutes happened every night I was home. The 2 minutes, it was, 10 minutes, a half hour, whatever, reading a book. And I think if you talk to my kids, it was a really important time for them as well, because it gave them, they knew they had that time of the day when it was just them. My two boys, each of them had their time with me. And it could be quick good night. It could be stressful. It could be anything. Right. And it's one of those moments I look back on with great fondness, as I'm sure they will as well.
What would your ideal behavioral health world look like? If we could make massive change within 5 years, what is ideal? What do you think is the solution?
It's about screening. It's about surveillance. It's about broadband testing, right? Now the public is very used to hearing about testing and the need for testing and the need for the data to tell the story. None of this, if we don't test it, it doesn't exist crap that's been going on for the last 4 years. Real true science matters, and real true testing and real true outcomes matter, right? So let's not be afraid of testing all the students in the school district once a month, once a week, right? Once a quarter. Let's start off easy, make it a quarterly test, and we'll do, surveillance testing on a quarterly basis. Nursing homes, great tool, great location. They're not going anywhere. They're dying for engagement, right? What if we tagged our local high schools with our local senior centers and had opportunities to share and connect and create synergies between the two post-COVID, right? I just think it's time for us to think more broadly and get out of this, if I need mental health services, I need to go someplace. No, we can bring the mental health services to you, and it may not be in the traditional sense that you're used to, right? I think we have to get innovative, right? I think the collaborative care approach, how do we spread a very narrow number of psychiatrists broadly across a whole network of need, right? We've got to be using social workers. We've got to be using the primary care network. We've got to be using nurse practitioners. We've got to be rethinking the delivery model. And needing a bed is okay, but you shouldn't have to get to the place where you need a bed. You should have the capacity to have a conversation and get some of your needs met in the community a lot quicker.
James, you've described so many aspects of the model, and yet there's a really simple message and a very inspiring vision, which is let's just spread the testing, make sure people have access and are getting assessed. So I really appreciate that vision.
You bet. Happy to help, happy to share, happy to think.
Thank you so much. We really appreciate you being on the show and sharing your thoughts. I think you have really brilliant ideas, and I'm excited to watch you implement them, because it sounds like a great world. So thank you for being on, and thank you all for joining us today. We'll talk to you soon.
What a wonderful opportunity.